This morning, I'm very excited to talk with Dr. Brian Jones. Am I right?
Brian Stone.
Brian Stone. Dang it. Can I start again?
Sure.
Dr. Brian Stone is with us, the IRMC physician group. I had it in the top of my head, then I started talking about large chihuahuas, and it just lost it. Dr. Brian Stone, sports medicine.
Correct.
We're also going to talk about the Saturday morning injury clinic, the walk-in clinic, which is a part of what you're helping to head up as well. But let's talk a little bit about sports medicine as a whole and what you're able to do for folks who have suffered sports injuries and maybe prevent some sports injuries too.
Sure. So, like you said, I'm a sports medicine physician, family medicine background. Mm-hmm. I see sports medicine as an extension of family medicine, dealing specifically with musculoskeletal complaints. So, it's called sports medicine, but I think that, I treat every athlete from college, high school to the weekend warriors. Mm-hmm. I also see, work-related injuries, roller coaster-related injuries.
Tripping off the curb injuries,
off the curb,
all of those things, yeah.
Anything bony or muscular that hurts, come on and I'll take a look.
Well, that's what when I wrote the last commercial, it was the missed a step on the ladder. Those sorts of things that we've been doing all our lives. Maybe at some point in our life we're not as strong as we once were. Our balance isn't as good as it once was. And we suffer an injury, we say, I've been doing that all my life. How did I manage to do that? But it's common, isn't it?
And it happens. Something that you don't recognize changed, and it changes some biomechanics that causes some kind of chronic injury, and then all of a sudden you notice that it hurts. And it's a chronic thing that's become an acute problem.
Yeah. When we're thinking about sports injuries, of course, lately the big news is knees and heads. The concussion symptoms, the concussion protocols that are in place now that are so needed, and it looks like the whole sports medicine field is stepping up to address what is a very serious problem that we really don't have all of the answers to yet, do we?
That's correct. I mean, we're getting better. We're understanding it better. Depending on where you go, people treat it differently. But we're all looking for the best answers, mm-hmm. the best way to treat it, to really prevent, what has happened in the past with the chronic head injuries, the chronic traumatic encephalopathy that a lot of the NFL players were found to have in their brain. There was a study last summer that came out with over 90%, 95% of NFL players had that of the brains that they biopsied after death had this degeneration due to the chronic injuries to the brain. Yeah. And so by recognizing that and, really kind of treating the kids and the young athletes, early on and making them aware of the possibilities, I think we can hopefully prevent that from happening in the future.
Yeah, it used to be we just, break off a little smelling salt underneath their nose and send them back into the game. Can't do that.
No, you can't do that anymore. One of the things I tell a lot of the high schoolers that come in, they're just anxious to get it back out there and understand that, being a former athlete. But I tell them, by my age, even if you make it through high school to college and college to the pros, by my age, you're going to be retired more than likely. Yeah. And you've got another, hopefully 60, 70 years that you need your brain. And so we're trying to prevent any injuries that wouldn't allow you to do that.
Yeah. Dr. Brian Stone with us this morning. We're talking about sports medicine as a whole, and the injuries, particularly to the knee, in young people developing. I think that's one thing that people don't realize is we're asking these kids to do things 12 months out of a year now. Used to be basketball season was 4 or 5 months, and now it's a whole year long. The other sports, they're all taking all of our time as well. And these bones and joints, they're just developing, and they're not to the point where they can handle all of that stress all of that time, are they?
That's kind of an issue with some of the kids that, you pretty much have to specialize in a sport at this point early on. Mm-hmm. And there are kids that play sports all year round, and that's, they're not developed, like you said. and they don't have that time for the skeletal maturity to set in, so that they can continue to develop appropriately, leading to earlier injuries in kids that are overusing their legs, arms, etc.
Commonly at this time of the year, with high school sports seasons getting underway, the college sports seasons as well, there are more injuries to deal with. And that's the reason that once more the doors swing open, the Saturday morning injury clinic, or the walk-in clinic that is happening at the HMI building, the Human Motion Institute building, and you're very much involved in the Saturday clinic. Tell folks what it is and exactly who you're looking to see on a Saturday morning.
Sure. So we have a Saturday morning clinic, like you said, starting actually this Saturday, September 1st, and is going through November 3rd from 8 to noon. We're taking athletes that were injured Friday night, weekend warriors, some work-related injuries, people who don't want to take time off of work during the week, but they had something happen, they need to be seen. Concussions from the night before, we're going to try to take care of those the day after instead of making them sit and wait out over the weekend.
Sure. Those are the sorts of things. And of course, somebody needs an x-ray.
We'll get it that morning.
That morning right there.
Yes.
So you can take a look at it. You can see what you're dealing with. And a lot of cases, particularly with football season, that's one of the things we focus on. The knees, the ankles, the wrists, the fingers, they get tangled up in
the bottom of that
in a
pile.
face mask, and the bottom of the pile. Limbs come off, and you have to screw them back on, and off you go. It's not quite like that, but there are a lot of things that can happen in a football game, and every body part's affected.
That's right. During the tackle and during the course of the game, you never know what part of the body is going to get hit from where, from what angle, and we'd like our kids to be safe, but that's a rough game and things happen.
Yeah. So all of that can be checked out at the Saturday
Absolutely.
Morning Injury Clinic. And now it's 8 a.m. to noon, yes?
Yes.
8 a.m. to noon, the HMI building, Suite 100?
100.
Suite 100, which is just to the left as you walk into the building.
Correct.
All right, so that's it. You're going to be there most Saturdays? Are you alternating with other physicians?
There are several physicians and physician extenders that will be there throughout. We all take our turns.
Yeah, and so everybody can come in and get checked out.
Yes, absolutely.
All right, so who has the first shift?
I think Dr. Bone
Dr. Bone
has the first shift.
All right. Well, he's energetic.
Yes.
That's if he's anything, he's energetic. So
he is. He's certainly very passionate about taking care of the athletes.
Yeah, he absolutely is. I know from personal experience. Let's talk a little bit about sports injury prevention, because that has to be a part of what you do as well. When you have a student or a young person who has suffered an injury, a wrist, an elbow, a collarbone, something in the legs, and you're working on getting them back to not just peak performance, but everyday life, then there is also the component about preventing injuries in the future, isn't there?
Sure. So, I like to use physical therapy a lot, especially in the recovery of injuries. Like I said before, there was probably something that was wrong with the biomechanics, the way that the person was performing that action over and over and over again, and the chronic problem became an acute injury. So, after the initial injury is healed, or as it is healing, I personally like to use physical therapy to help with strengthening, flexibility, allowing the athlete or weekend warrior to better tolerate the stresses of what they're trying to do.
Yeah. And they learn a lot about how to treat their body when they go through that physical therapy process.
They should, yes.
Because
you would hope so.
Yeah, because you want to prevent the injury in the future. You don't want to have to go through this all over again.
Right.
Yeah.
Right.
So that has to be what a lot of what you talk with them about as you're getting them back on the road to recovery. Now, there is a difference, of course, between the young athlete and, as we call them, the weekend warriors, or even older folks who might twist an ankle falling off a high curb that they weren't expecting, even, slam that toe right into the front of the curb as they're getting that step up.
Sure.
Their bones have developed differently. They're at different stages of their lives, and I would assume that they have to be treated differently as well.
Well, kids are a little more durable. They heal a little bit faster than you and I would.
They bend more easily.
Well, yeah. So the older adults, depending on what the other medical issues are, that can change how well they heal. Somebody with severe osteoporosis is not going to necessarily heal as well as from a fracture as well as the 15-year-old. And so that might take a little bit longer. So, we try to treat everything differently, try to treat everything the same, appropriate. Sometimes things take longer in different individuals. And so there are different techniques and different things that you can prescribe to try to help that move along.
Maybe change your approach a little bit with that older person in terms of how you're going to treat that injury. Their goals are different as well, aren't they?
They are. A lot of the weekend warriors just are we're going to get back to functioning a daily life as opposed to performing at a higher level, especially with the younger kids in high school trying to get to that next level, trying to be able to perform at a higher level. So we're getting the younger kids, getting them back to a spot where they can hopefully develop to that next level.
Yeah. We're talking with Dr. Brian Stone. Just a couple of moments left. I want to get some hours and information for the Saturday morning injury clinic. You don't necessarily need to call ahead, but
it's a walk-in clinic.
Correct. It is a walk-in clinic. You can call and let them know you're coming, though.
Sure.
And that's 8 a.m. to noon on Saturdays.
That's correct.
For folks to see you in your regular business hours, what do they need to do? Who do they need to call?
They can call 888-452-IRMC and come and see me. I have plenty of space open on my schedule right now.
Okay.
Being one of the new physicians, it's filling up, but there's still plenty of space, and I'd be more than happy to see anybody who comes in.
And you work right out of that same Suite 100, don't
That's
you?
right.
At the Human Motion Institute.
Yes.
Well, very good. We've met Dr. Brian Stone, and you can meet him too if you have an issue medically that needs to be considered by him. I'm sure that you'd love to see them.
I'm sorry?
I'm sure you'd love to see folks come in.
Absolutely. Come on in.
It is the voice of Indiana County, WCCS AM 1160 and 101.1 FM.